COVID-19 vaccines not linked to sudden deaths, study reveals. Imagine this, the sudden unexplained deaths of young adults. And the first thing that comes to mind is COVID-19 vaccines. But here's where it gets controversial. According to the latest findings from the health ministry, it's not the vaccines that are to blame, but rather drug use and binge drinking. Let's dive into the details and see what the experts have to say. In a surprising turn of events, a comprehensive study has revealed that receiving 2 doses of the COVID-19 vaccine actually reduces the likelihood of unexplained sudden death. This revelation comes from a meticulous investigation conducted by the Indian Council of Medical Research, National Institute of Epidemiology, ICMR NIE. On July 25th, 2025, Union Health Minister J.P. Nadda shed light on the findings in a written response to the Lok Sabha. He emphasized that the health ministry does not track cases of heart attacks, but the study provides crucial insights into the factors contributing to sudden unexplained deaths among young adults. The ICMR NIE study, titled Factors Associated with Unexplained Sudden Deaths Among Adults Aged 18 to 45 Years in India, a multi-centric matched case control study, was conducted across 47 tertiary care hospitals in 19 states and union territories. The research focused on healthy individuals who died of unexplained causes between October 2021 and March 2023, despite having no known comorbidities. The study analyzed 729 sudden death cases and 2,916 control cases, individuals without the condition. The results were clear. Receiving 2 doses of the COVID-19 vaccine significantly lowered the odds of unexplained sudden death. This finding challenges the misconception that vaccines are a risk factor for sudden deaths. Nadda elaborated. The study observed that COVID-19 vaccination did not increase the risk of unexplained sudden death among young adults in India. Instead, past COVID-19 hospitalization, a family history of sudden death, and certain lifestyle behaviors increased the likelihood of such deaths. And this is the part most people miss. The study also highlighted that vigorous intensity physical activity within 48 hours before sudden death was significantly associated with unexplained sudden deaths. This raises an important question. Could intense exercise be a hidden danger for some individuals? The health minister also referenced another study conducted by the All India Institute of Medical Sciences, AIMS, in collaboration with ICMR. This study aimed to identify the common causes of sudden deaths in young adults. Early data from the AIMS study indicates that heart attacks or myocardial infarctions remain the leading cause of sudden death in this age group. Interestingly, no significant changes in the pattern of causes have been observed compared to pre-pandemic years. Together, these 2 studies provide a more comprehensive understanding of sudden unexplained deaths in young adults in India. They reveal that COVID-19 vaccination does not increase the risk, whereas underlying ill health issues, genetic predisposition, and risky lifestyle choices do play a significant role. So, what do you think? Does this change your perspective on the factors contributing to sudden unexplained deaths? Share your thoughts in the comments below, then let's spark a conversation. Do you agree with the findings, or do you have a different take on the matter? Let's hear it. Understanding sudden deaths. Health issues versus COVID vaccination. The alarming rise of sudden deaths. Unpacking the myths and realities. Are COVID-19 vaccines to blame for the increasing number of unexplained fatalities in India? But here's where it gets nuanced. In a recent address to the Lok Sabha during the monsoon session, Union Health Minister J.P. Nadda shed light on a critical concern that has been shrouded in uncertainty. Contrary to widespread fears, Nadda emphatically stated that COVID-19 vaccination does not increase the risk of sudden deaths. This assertion is based on concrete evidence from comprehensive studies conducted by the Indian Council of Medical Research, ICMR, in collaboration with the National Center for Disease Control, NCDC, and the All India Institute of Medical Sciences, AIMS. Delving into the findings, Nadda highlighted that underlying health issues, genetic predispositions, and risky lifestyle choices are the primary culprits behind the surge in unexplained sudden deaths. The studies meticulously analyzed the causes of sudden fatalities, particularly among young adults in India, and found no correlation with COVID-19 vaccination. However, past COVID-19 hospitalizations, a family history of sudden deaths, and certain lifestyle behaviors were identified as significant risk factors. A surprising yet crucial insight from the AIMS-led study indicates that heart attacks or myocardial infarction (MI) remain the leading cause of sudden death in this demographic. Notably, the pattern of causes has shown no major deviation when compared to pre-COVID-19 pandemic years, offering a sense of continuity amidst chaos. Meanwhile, the COVID-19 landscape in India continues to evolve. As shared by Union Minister of State for Health and Family Welfare, Prataprao Jadhav, in a written reply to the Lok Sabha, the recent summer wave saw a modest increase in COVID-19 cases from late May 2025, only to decline substantially by mid-June. A somber reminder of the pandemic's ongoing impact. Between April and July, COVID-19 claimed 164 lives, with the majority of the deceased having pre-existing comorbidities. Now, we invite your thoughts. Do you believe the findings adequately address concerns over COVID-19 vaccination and sudden deaths? How can public health initiatives better mitigate the risks associated with underlying health issues and lifestyle choices? Share your perspectives in the comments below. ICMR study debunks COVID vaccine sudden death link. Real risk factors exposed. In a significant revelation, Union Health Minister J.P. Nadda has announced that the COVID-19 vaccination does not contribute to an increased risk of unexplained sudden deaths among young adults in India. This statement is based on findings from a comprehensive study conducted by the Indian Council of Medical Research, ICMR. The ICMR's research highlights that certain factors, such as a history of COVID-19 hospitalization, a family background of sudden death, and specific lifestyle choices are more likely to elevate the risk of these mysterious fatalities among the youth. To delve deeper into the causes of sudden death, the ICMR, in collaboration with the National Center for Disease Control, NCDC, employed two distinct methodologies. The first was a retrospective case control study aimed at identifying risk factors linked to sudden death. The second approach involved a prospective investigation of sudden deaths in young adults, utilizing a virtual autopsy technique to gather more accurate data. In response to inquiries, Minister Nadda explained that the research gathered extensive information regarding various aspects, including COVID-19 vaccination status, history of infection, post-COVID health conditions, family history of sudden death, and lifestyle habits, such as smoking, recreational drug use, alcohol consumption, binge drinking, and engaging in vigorous physical activity within 48 hours prior to the death or interview. According to the health minister, individuals who received 2 doses of the COVID-19 vaccine experienced a notable reduction in the likelihood of unexplained sudden death. The study identified several factors that can increase the risk of sudden death, including a previous hospitalization due to COVID-19, a family history of sudden death, binge drinking within 48 hours before the incident, the use of recreational drugs, and engaging in intense physical activity shortly before the event. Experts have also pointed out that underlying health conditions, genetic factors, and risky lifestyle choices significantly contribute to the occurrences of unexplained sudden deaths. But here's where it gets controversial. While the study provides reassuring data regarding the safety of COVID-19 vaccines, it also raises questions about the broader implications of lifestyle choices and genetic predispositions. What do you think? Are we overlooking the impact of lifestyle on health outcomes? Share your thoughts in the comments.